I want you to imagine being a patient sitting in front of me. Their eyes are wide with a mix of fear and confusion. And they tell me, my throat just closes up and it feels exactly like my anaphylactic reaction did. I can't breathe. I start to panic. I reach for my EpiPen, but the Epi didn't really work. And later, I'm told it wasn't an allergic reaction at all. What's going on? Hi, everyone. My name is Dr. Kara Wada. I am a board-certified pediatric and adult allergy, immunology, lifestyle medicine physician, and I've dedicated over 15 years to helping people with complex immune conditions. I also live with one myself. I am an autoimmune patient with Sjogren's disease, and I deeply understand the journey of living with a body that often feels unpredictable and misunderstood. This story I shared is something I hear more often than you might think. Someone experiences a genuine, terrifying airway emergency like anaphylaxis, an asthma exacerbation, or asthma attack. And then in the weeks or months or years that follow, they face recurrent episodes of that same throat tightness and breathlessness. And in the moment, those symptoms are indistinguishable from that original reaction, just as scary. And yet, when we investigate closely, it often turns out to be a condition called vocal cord dysfunction. Now, it is sometimes also termed inducible laryngeal obstruction. So you may see the term VCD or ILO, and they mean the same thing. And today I want to invite you to look at this condition through a different lens, a trauma-informed lens. So what exactly is vocal cord dysfunction or inducible laryngeal obstruction? First, let's understand the mechanics. Vocal cord dysfunction, or ILO, happens when the vocal cords, which are supposed to remain open when you breathe in, paradoxically close instead. This narrows your airway, making it feel like you cannot get air in. And these symptoms can be incredibly frightening, often mimicking severe asthma or even anaphylaxis. So you might feel a sense of throat tightness or closure, difficulty getting air in, a high-pitched wheezing sound known as stridor, and a feeling of panic and not getting enough air. Crucially, standard treatments for asthma or allergies like inhalers, antihistamines, or even EpiPens often provide little to no relief in that immediate setting. So I want to talk a little bit about trauma, the voice, and the airway. So here's where we need to look a little bit deeper. Your larynx or your voice box is so much more than just an anatomical valve. It sits at the crossroads of our breath, our speech, and our emotion. I want you to think about it. Your voice tightens with fear. Your throat constricts with unspoken grief. It is an emotional organ just as much as a physiologic one. It also is this interface where both our airway and our food tube, our esophagus, meet. We are the only species that shares this common space. And so this area of our anatomy is really critical to have nerve endings that are very sensitive because we don't want food going down the wrong tube. Everyone's had that happen. It feels pretty uncomfortable, pretty scary. And we want to stay alive, right? We can't breathe and eat at the same time. So I want to talk about this aspect of it being an emotional organ too. Emerging research is backing this up. A recent study just last year in 2024 studied adults and children with inducible laryngeal obstruction found significantly elevated rates of anxiety, depression, and PTSD. Now, this is not a causation study, right? We just know that people who have vocal cord issues are also more likely to have anxiety, depression, PTSD. And in fact, nearly half of participants scored in the moderate to severe range for physical somatic symptoms. That's the body expressing emotional distress physically. Another review found that psychological causes may underlie about 70% of VCD cases. And this is not to say the symptoms are all in your head. Very far from it. It suggests that for many, vocal cord dysfunction may emerge as a defensive, trauma-driven reflex. As Dr. Bessel van der Kolk so powerfully explains in his groundbreaking book, The Body Keeps the Score, our bodies hold on to traumatic experiences. If you have experienced a terrifying, life-threatening airway emergency, like anaphylaxis, like an acute asthma exacerbation, like a choking episode, your body remembers that. And that memory is not just in your mind, it's etched into your nervous system as a whole. So that throat may be literally replaying that memory of the threat anytime it senses anything close to or in the neighborhood of what that threat started out as, manifesting then as paradoxical, protective closure of the vocal cords. So what are the clinical implications and where do we go forward? What is our new path to healing? So how does this trauma-informed lens change our approach? First and foremost, it is absolutely critical to rule out true anaphylaxis. These episodes feel undeniably real and threatening, and we must always address the most dangerous possibility first. So we need to make sure, is this anaphylaxis? Is this an acute asthma exacerbation? Is someone choking, right? All of those things we need to think about very thoughtfully and work through. Once we've confirmed it's vocal cord dysfunction or ILO, we can start to expand our toolkit though beyond just the physical. And this is often where, as an allergist immunologist, I am frequently working with my ear, nose, and throat colleagues, specifically laryngologists who are specialized ear, nose, and throat docs that have expert training in the voice box or the larynx. They often will work together with speech therapists and help with this diagnostic evaluation. Typically happens in an office, usually does not require any needles or anything. Usually they will use a very small, flexible camera to look at the vocal cords moving in real time with a camera. And when that diagnosis is confirmed, or if we're really suspicious for it and having trouble getting that evaluation, often we will try speech therapy, breathing retraining, and those remain very central to the treatment of vocal cord dysfunction. A speech language pathologist can teach you specific techniques to relax your throat muscles and regain control of your breathing during an acute episode. They also have techniques that can help retrain symptoms and the muscles on a more long-term protective standpoint. But for many, this may feel incomplete if the underlying psychological driver isn't also addressed. And this is where trauma-informed interventions can also become an important part of this treatment pathway. Those may include somatic therapies. These are ways to help you reconnect with your body, your voice, and your breath in a safe way. It may involve trauma-focused psychotherapy, like cognitive behavioral therapy, EMDR, and other similar modalities. And often will include mind-body strategies to help you regulate your nervous system, things like humming, singing, yoga, and specific breathwork practices. Most importantly, multidisciplinary care, where your experience is validated both physically and emotionally, really need to be at the core of treatment of ILO or VCD. So we need to rethink VCD while honoring our body's story. I think labeling vocal cord dysfunction as potentially psychogenic or trauma-rooted does not diminish its physical reality. It honors it. It acknowledges that the body remembers what the mind might try to forget. And that terrifying feeling of feeling that your airway is closing is real because your body is re-experiencing a past threat. As clinicians and as patients, expanding our approach to include both the mechanics of the breathing and the potential for psychological healing is key. For those patients whose vocal cord dysfunction may be rooted in trauma, this integrated approach can help them finally breathe easier in both body and spirit. If you are struggling with complex, overlapping symptoms and are looking for a provider who will deeply listen and look for these connections, I'd be honored to work with you. You can find the links for all the states where I am licensed, where I offer telehealth appointments and in-person appointments through my practice, the Immune Confident Institute. And please join our free Facebook group, the Becoming Immune Confident Community, for ongoing support and connection. Let's open this conversation. Have you ever experienced unexplained throat tightness or difficulty breathing? What has your journey been like in trying to find answers? Share your story in the comments below. Let's create a space of understanding and support. And don't forget to subscribe for more deep dives into the mind-body connection. Until next time, take care.